Hi, my name is Kasara Dayet, and I am a licensed clinical psychologist in the state of Massachusetts and owner of Cup of Tea Counseling LLC. Most of my patients call me Dr. Dayet. Some of my kiddos I work with call me Dr. K. If you want to know more about me, my background, and my working philosophy, you can check out the link to my website at the description below. So I'll jump right into it. I've been wanting to do this video for about 4 weeks now about what I was anticipating it would be like working as a therapist during a pandemic. I haven't posted this video yet, mostly because of fatigue, but I finally made it and I'm glad you're here. Nevertheless, I hope this video speaks to you, therapists specifically, as well as other individuals who may be watching who want this perspective. I wanted to start with the fact that I consider psychology, social work, and so on to be health care professions. Many of us in the field, this is not new to me, have advocated for this for years. And historically, clinicians have not been thought of as healthcare professionals. And this has led to mental health not getting the attention and funding it deserves, and has increased the stigma for people who are hoping to seek care and support in the first place. Mental health is often the last thing on people's minds after a tragedy or disaster has already occurred. And now that we are 4 or 5 weeks into the quarantine here in Massachusetts, people are finally starting to think about the impacts of this on their mental health. Additionally, not thinking of this as healthcare means that clinicians are underpaid for the work that they do. We get into this field to help people, but we also want to make a living wage. So this is the backdrop that we started the pandemic with. We as therapists fighting for people to have access to good mental health care, while also for us to be paid living wages for what we do. We started the pandemic with significant stress. Our seen frontline healthcare workers include nurses, doctors, lab techs, etc., who today still are fighting for access to appropriate PPE and have had to make unimaginable decisions around rationing critical care services. And then we also have psychologists and other clinicians doing case management, end-of-life care, trying to connect people to food and housing, managing substance abuse programs and group homes, still putting their lives at risk. And I have so many colleagues who fall into this category, and I used to as well, and they are on my mind every day. Our training did not prepare us to provide psychological care in the middle of a pandemic. What's been on my mind is what happens when the therapist is going through what the patient is also going through. Though sometimes we can relate to our patients, a large portion of the time we are not dealing with exactly the same thing our patient is. We usually have some measure of distance that affords us the ability to tap into our training and experience to offer perspective and support. And now the question is, what do I do when I'm on tumble dry low or maybe high, worrying about what's happening to my own family in one of the hardest hit states? How do I address the questions of parents trying to manage their kids and maintain harmony and safety in their homes during an unprecedented time? How do we manage as therapists and make sure that we are properly present for our patients? How do we remain a solid, stable foundation for our patients? How do we respond to them being disconnected from their resources or worse, dying? Can we take on seeing additional people and properly be there for them and not let our stuff get in the way? It's hard to say that any one person could do all of that successfully. Therefore, I wanted to say that, there are resources and recommendations that I've seen floating around there for therapists, and I wanted to offer my perspective on 5 of them. So the first is seeking supervision and consultation. That's a pretty regular recommendation for us, but what do we do? Like with our patients, our peer supports are going through the same thing. What happens if my patient gets sick? What if it's the worst it could be for them? And then what's happening to maybe my own family and my loved ones? Have any of them lost their jobs or are getting sick? Am I losing patients as a result of changes in their economic circumstances? And so, in short, All of our peer supports are asking themselves all of these questions right now. Usually they have some measure of distance from the things that we are seeking support for, but right now they're struggling with largely the same things across the board. And so we are trying to rely on our supports, but they are not the same as where they were to start. So if you are a therapist listening to this, I am making this to say that you are not alone. This is very overwhelming. If you are one of the therapists who have found that one of your ways to deal with this is the second thing I've seen, is to offer free services to healthcare workers or step up your availability, great. If not, that's okay too. We owe it to our patients to honor our boundaries. People will still need us whenever this is over, and we want to make sure we are taking care of ourselves so that we can be there for them when they do need us and when we know we can be there for them. A third recommendation I've seen for therapists is community work and activism, if that's within your bandwidth. For me, this is the biggest way that I cope, including making these videos. I've been calling state and local boards weekly to make sure I know what people are expected to pay, how much therapists are getting paid while doing telehealth, making sure guidelines are clear, and asking to be reasonably notified about changes from insurance companies. This is still an ongoing fight. So for those who are willing to join me and the others who are already doing this, we welcome you. I make calls every week, so feel free to reach out to me to let me know what kind of work needs to continue to be done. A fourth recommendation is that some therapists have offered support groups. I think this is wonderful, but we do need to make a distinction between opening up a group that's just to provide a space for people coming together to support each other versus a group that is meant to provide a specific, detailed therapeutic intervention and support service. I feel very strongly that some of these groups that have popped up out there in response to the pandemic are not being as clear that the therapist is providing a service, but then it's asking people to pay to be in the group. This risks potentially harming and traumatizing the participants if the therapist does not make it clear what they are doing or that they know what they are doing. And if you're running these groups and accepting money, you should be providing a clear service. If you're someone seeking out a group, ask questions, scrutinize the groups, and if something doesn't feel right, don't do it. Well-meaning people can still do harm if things aren't thought out and they do not have the proper experience. We have a little bit of a luxury as mental health professionals to be able to think longer about this than maybe a doctor who has to make a quick decision. The last thing is scheduling. I am usually pretty internally motivated, but I have found it very hard to follow these recommendations for scheduling. So I've been talking with my patients about making a loose schedule. I do the same thing myself. Picking 3 things I want to accomplish during the week, like making these videos, and then breaking them down into their smaller tasks to make sure that it's actually achievable this week. I think this loose structure can honor the way we are authentically showing up in our lives right now and give us some measure of self-compassion and flexibility around the speed they are accomplished. I think this is where I will stop. I wanted this to not be too long and more offer my thoughts, partly advice, but not repeat information you can find out there anyway. If you want more traditional resources, you can look on my website so you can digest it at your own speed, and you can also check out my blog for my opinion pieces. I will be joining up, as you'll see on my website, with other colleagues to do some other informational videos and share things that other colleagues have been putting together. Please head to my website if you want to send me any messages or tell me what you'd like to see. If you're a therapist, I would love to get your thoughts about other things you may want covered. If you're a healthcare worker or any kind of first responder, I want to hear from you directly. I don't want to speak for you. I want to know what you want from us right now.